Okay. Patient is laying at a 30 to 45 degree angle with her head elevated. I'm going to start by assessing the jugular veins. So I'm going to have you turn your head to the right. Good. And now turn your head to the left. I see some visible pulsations for the jugular veins. However, I do not see any significant edema that would be of concern. I'm now going to inspect the pericardium. I'm going to do so by visibly inspecting for pulsations. There is no heave or lift. I will now take my stethoscope and auscultate the heart sounds, starting with the diaphragm of the stethoscope. I'm counting for a full 15 seconds when I'm doing so. Good. Now I'm going to switch to the bell of my stethoscope and listen once again. Good. I don't hear any S3 or S4 heart sounds. Now going to have you exhale for me and hold. Okay. And I'm unable to palpate any thrill. Okay, now I'm going to have you turn over to your left side. And with the bell of my stethoscope again, I'm going to listen to the apex of the heart. Good. Okay, now lay flat for me. Okay. I'm now visually inspecting the abdomen. I'm looking for pulsations or deformities, and I do not see either. Now I'm going to listen to the bowel sounds in all 4 quadrants. Okay. Bowel sounds are normal active. I'm now going to use the zigzag method and palpate the abdomen. Okay. I'm now going to palpate. Do you have any pain?
Nope.
Any pain?
Nope.
Pain?
Nope.
Pain?
Nope.
I'm now going to press a little deeper. Do you have any pain?
Nope.
Pain?
Nope.
Pain?
Nope.
Pain?
Nope.
Okay. I'm now going to feel for your liver for any distension. And for your spleen. Good. There's no liver distension or splenomegaly noted. Okay, now I'm just going to have you extend your leg out to the side if you can. Perfect. And back in. And now the other leg. And back in. And of course we would have more room. Can you lift your leg up for me? And back down. And up. And down. And bend your knee in. Bend it in towards you. And out. And do the same with the other leg. Perfect. I'm going to have you lift this leg up again and push towards me. Good. And back down. Great. And again with this leg. Push towards me. And against me. Perfect. Now I'm just going to feel for pulse. pulses are positive in all 3 locations bilaterally. I'm now going to feel for any edema. No edema noted on the left. No edema noted on the right. Skin temperature is cool and dry. At this point, I would assess cap refill. Obviously, patient would not have socks on. I would inspect in between the toes. Okay, now I'm going to have you pull your feet up towards you and flex them down. Good. And now I'm going to have you bend your ankles out towards the sides and in towards you. Perfect. Okay, now I'm going to have you take your right foot and put it up towards your knee and drag it down to your toes.
Oh, wrong foot.
And then your other foot up to your knee and drag it down to your toes. And now I'm just going to feel for reflex. Good. Okay, now I'm just going to have you stand and sit in this chair and we'll continue the exam.
Okay.
Ow. That's okay?
Yeah.
Okay. Okay. So now I'm going to have you take your legs, bend your knees straight towards me on the right, and back down, and now with the left, and back down. Okay. I'm now going to assess your reflexes. Actually, I'm just going to have you dangle your feet for me.
Oh.
Perfect. That's okay. Great. Now I'm just going to grab a few supplies. Now I'm going to take an object and I'm going to rub it against a few different parts of your body. You're going to tell me where you can feel the sensation and what it feels like.
Okay.
Okay, so just close your eyes for me.
On my face, and it's soft.
Perfect.
Arm soft. Hand soft. Arm soft. Forearm soft. Foot soft. Foot soft.
Good. Now I'm going to take a object and you're going to tell me if you feel a dull sensation or a sharp sensation. And this is going to feel dull.
Dull.
And this is going to be sharp.
Okay.
Okay. Now what does this feel like?
Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp.
One more time.
Oh, dull. Sharp. Dull. Sharp. Dull. Sharp.
Good. All right, now keep your eyes closed for me. I have two objects. One is going to be a paper clip and one is a coin. And I need you to tell me what you feel in each of your hands.
Okay.
So reach your hands up for me. Perfect. And tell me what you feel. You can hold on to that. What is that?
Paperclip.
Perfect.
Coin.
Perfect.
Coin. Paperclip.
Very good. Okay. Now I'm going to bend one of your fingers and I need you to tell me which finger on what hand I am bending.
Index finger, left hand.
Perfect.
Index finger, right hand.
Okay, now take a look at me. I'm just going to have you take your hands and move them really quickly as fast as you can together. Perfect. Okay. Now I'm going to have you stand up. I'm going to have you turn and walk towards the fridge. And when you get to the fridge, I want you to heel to toe turn towards me and walk back. Very good. Now turn around again and walk towards the fridge on just your heels. Good. And back towards me on your toes. Very good. Okay. Now I'm going to have you close your eyes for me. Yep. Close your eyes. Perfect. And stay feet together. Stay nice and still. And I would do this for approximately 20 seconds. Good. Okay. So now I'm going to have you reach down and touch your toes. Very good. Stand up. Now bend to the side. Good. Bend to the side. Very good. Twist at the waist. And the other way. Very good. And lastly, I'm just going to have you turn and face the exam chair, hands on the chair, and squat down for me. And back up. Perfect. Well, that concludes our exam. You did great. Everything looks okay. And thank you for your time.
Okay, thank you.
You're welcome.